Welcome back to Mountain Connections. Right now we're going to take a moment to discuss your health, specifically GI cancers. Unfortunately, GI cancers are the highest amount of cancer diagnosis right now, and they have the highest amount of deaths compared to other cancer-related deaths. What do you need to know? Well, I recently spoke with a doctor from Baylor Medical Center, as well as an individual from Debbie's Dream Foundation. All about this. Let's take a look.
Gastrointestinal GI cancers, which include cancer of the stomach, esophagus, and other organs within the GI tract, can be aggressive, may require multiple treatment approaches, and have the potential to recur. Combined in 2021, GI cancers have the highest number of new cases relative to other cancers and are leading cause of cancer-related deaths in the country. Here with important information on managing a diagnosis of some GI cancers and the progress that has been made in treatment options are Dr. Ronan Kelly, Director of the Charles A. Sammons Cancer Center at Baylor University Medical Center, and Michael Ehren, Board President of Debbie's Dream Foundation, Curing Stomach Cancer. Thank you, both of you, for being here today.
Thank you very much.
Thank you.
Michael, what are the most common types of GI cancers and their impact on Americans?
So GI cancers can impact any of the organs in your digestive system, but the more common upper GI cancers are stomach, esophagus, and the junction between these two organs. And what we have seen is the impacts on patients in America and around the world are significant. These are often very aggressive cancers. They're often diagnosed at late stages because of the similarity of these symptoms to other common conditions like indigestion and heartburn and the like. And so oftentimes what we are seeing is patients do not realize they have cancer until it is later in the game. And for metastatic or advanced stage gastric cancer, the 5-year survival rate is roughly 5%.
Michael, what is the experience like for patients who are diagnosed with certain types of upper GI cancers, like those in the esophagus and stomach?
So in my firsthand experience at Debbie's Dream Foundation, we have seen a very difficult patient experience, overall. There are significant physical, emotional, mental, impacts on the patients, including stress, anxiety, isolation, depression, inability to eat, which is a very important part about fighting your battle. Patients often have to undergo multiple treatment approaches with risk of reoccurrence, which can be difficult. But often what we are seeing is people, oftentimes have not heard of these types of cancers, are not familiar with them, just like they are with other more common ones. And so they often do not know where to go and where to go for information and resources. And that is something that, at my organization, we have been working very hard to correct.
Dr. Kelly, if someone is diagnosed with certain types of upper GI cancers, like those in the esophagus and stomach, what are their options?
Well, thank you. And, it's a pleasure to be here today. We're here to talk about some really exciting treatment developments that have happened this year with the introduction of drugs called immunotherapy drugs into the historical treatment landscape, which, as you know, has been predominantly chemotherapy, surgery, or radiation. But now we have a fourth pillar, which is immunotherapy. And one of the drugs that we'll talk about today is Opdivo, which was studied in 2 global studies, which have really changed the landscape for the treatment of gastric and esophageal cancer. But before I get into really the treatment trials itself, I think it's important for every patient to talk to their doctor about the side effects associated with these drugs, because that they will need to understand that before, as part of the treatment decision-making progress. But really what we've seen now is historically gastric cancer was treated with chemotherapy alone if it was advanced or metastatic in nature. And now it's chemotherapy plus this immunotherapy drug called Opdivo, because we saw a much improved overall survival benefit for patients that got the combination of the 2 drugs. And then in the other disease setting, it was in esophageal cancer, in early stage disease, people with operable cancers, where before they were treated with chemoradiation and surgery. Now what we're doing is we're adding the immunotherapy drug after surgery, giving it to patients for a year in an attempt to prevent the disease from ever coming back. And we've seen really amazing results. So it's really the start of a whole new treatment era, I think, for patients with these particular cancers.
Dr. Kelly, how does immunotherapy work?
Well, it's a great question. And, for your listeners and viewers, I think the the whole world now knows about how important our immune system is in the fight against cancer. We see this every night, obviously with the COVID pandemic. But this immunotherapy drug, which is made by Bristol Myers Squibb, is turning on patients' immune systems to wage a war between their good cells, which are their immune cells, and their bad cells, which are their cancer cells. So now people can understand that our immune system is not just important in the fight against COVID-19, it's equally as important in the fight against cancer, and that's how these drugs are really resulting in much improved outcomes for patients.
Michael, where can the viewers go for more information here?
They can go to the Debbie's Dream Foundation website at debbiesdream.org. And for your listeners' background, we are a national leading gastric cancer nonprofit that provides an array of services, support, and information to patients and their families, including support groups, nutritional information, mentors with prior patients and caregivers, as well as a 24/7 hotline to get more information and resources at your fingertips. And we have been fortunate to have been supported by Bristol Myers Squibb in our endeavors, particularly throughout the recent pandemic, for which we are very thankful. And I would also say, in addition to our website, if you want more information about this particular treatment that Dr. Kelly was just referencing, you can go to opdivo.com.
Well, thank you so much, Dr. Ronan Kelly and Michael Ehren, for being here today, giving us this important information about GI cancers and their treatments right now. I appreciate your time.
Thank you so much.
Very much.